As we grow older, we tend to get used to little changes in our bodies, a bit more tired than usual, a strange ache here or there, or days when we just don't feel like ourselves. And often we shrug it off. We say, it's just part of aging, or I'll deal with it later. But sometimes those quiet changes are more than just age, they're your body's way of whispering that something serious may be going on. In today's video, we're going to talk about 6 symptoms that doctors say you should never ignore after the age of 60. These are the body's warning signs, subtle, sometimes silent, but deeply important. Recognizing them early could mean the difference between recovery and something much more serious. This isn't about fear, it's about awareness. Because when you know what to look for, you give yourself the power to act, to protect your health, and to live your years ahead with strength and peace of mind. If you care about staying informed and supporting a life of senior wellness, please take a moment to subscribe to our channel. Tap the like button if this message resonates with you, and share it with someone you care about. Let's walk through these important signs together. Your health, your life is worth paying attention to. Unexplained. Extreme fatigue. There's a big difference between feeling tired after a long day and experiencing a deep, overwhelming fatigue that lingers without explanation. If you've ever felt completely drained even after a full night's sleep, or noticed that everyday tasks suddenly feel like too much to handle, it may be more than just getting older. This type of exhaustion isn't the kind that disappears with a nap or a cup of coffee. It's persistent. It weighs on you, making it harder to get out of bed, cook a meal, or even hold a simple conversation. You may have once enjoyed daily walks or gardening, but now find yourself out of breath or needing to sit down after just a few minutes. Many older adults assume this is just part of aging, but doctors warn that unexplained extreme fatigue can be a serious red flag. It may indicate that your heart isn't pumping as efficiently, your organs are under stress, or your body is conserving energy because something deeper is going on. Conditions like heart disease, kidney problems, or even certain cancers often show up first as a sudden drop in energy. What makes this type of fatigue especially concerning is when it comes on suddenly or worsens over time. If you used to feel reasonably energetic, but now struggle to complete even the simplest routines, your body may be trying to tell you that it needs help. Let's take an example. Mr. Lewis, 72, was always active, but over a few weeks he noticed that walking from the kitchen to the front door left him winded. He felt like he was walking through sand. When he finally mentioned it to his doctor, further tests revealed a heart issue that thankfully was caught in time. At Senior Wellness, we believe that tuning into your body and trusting those inner signals is one of the most important forms of self-care. Fatigue may seem harmless, but when it's sudden, intense, and unexplained, it's a symptom worth listening to. So what should you do? Pay close attention to when the fatigue began, how long it lasts, and whether it interferes with your daily life. Write down what you notice. If it's getting worse or stopping you from doing the things you enjoy, don't wait. Make an appointment with your doctor. It's always better to be safe, and early care can make a world of difference. And remember, honoring your health is not a sign of weakness, it's a strength. When you stay aware, ask questions, and take action when something feels wrong, you're protecting not only your body, but your independence and quality of life. Because here at Senior Living, we know a healthy life starts with listening and responding to what your body is trying to say. Sudden and severe, chest pain or pressure. There's one type of discomfort that should never be ignored: sudden, intense chest pain or pressure. It may feel like a heavy weight pressing on your chest, squeezing tightly, or radiating into your arms, jaw, back, or neck. If this happens unexpectedly, it's your body's way of urgently calling for help. Many older adults, especially those over 60, often downplay chest pain. You might assume it's indigestion, stress, or just a pulled muscle. But doctors warn that this kind of pain, especially when sudden or severe, can be a sign of something far more serious, such as a heart attack or an aortic emergency. Not every heart attack looks like it does in the movies. In fact, some people feel only a dull discomfort or mild tightness in the chest, paired with symptoms like dizziness, nausea, shortness of breath, or a cold sweat. That's why it's easy to mistake for something less urgent. But time is critical. In some cases, the pain might feel sharp tearing, or like something is ripping inside the chest. This can be a warning of a rare but extremely dangerous condition involving the aorta, the body's largest artery. When this occurs, immediate medical attention is the only way to prevent a life-threatening outcome. Let's consider the story of Ms. Harris, age 69. One afternoon, she felt a strange tightness across her chest. It wasn't unbearable, but it was unusual. She waited, hoping it would go away, but thankfully her daughter insisted they go to the hospital. That decision, made within minutes, may have saved her life. At Senior Wisdom, we always encourage listening closely to what your body is trying to say. When something feels different, wrong, or sudden, especially around the chest, it's better to act quickly. So what should you do if you experience chest pain like this? Don't lie down and wait it out. Don't hope it passes. And please don't convince yourself it's nothing. Call emergency services right away. Getting care fast can make the difference between a full recovery and a critical situation. Chest discomfort, even mild, should never be taken lightly, particularly if it's new or paired with other unusual symptoms. A visit to the doctor, even just to rule things out, is always worth it. Your health is too important to leave to chance. Here at Senior Wellness, we believe that informed action is a powerful form of self-care. You deserve to live with confidence, not fear, and that begins with knowing when to act. Your heart has carried you through so much. Let's make sure you take care of it just as it has taken care of you. Difficulty breathing or shortness of breath. Imagine sitting in your favorite chair, not doing anything strenuous, and suddenly finding it hard to catch your breath. You take a deep inhale, but it still feels like you're not getting enough air. This kind of breathlessness may seem minor at first, but for older adults it can be a sign of something serious beneath the surface. Shortness of breath that comes on suddenly or worsens over time should never be brushed aside. Doctors often see this as a key warning sign of heart failure, lung issues, or even a blood clot in the lungs, a condition known as pulmonary embolism. Any of these can be life-threatening if not treated quickly. Sometimes this symptom is overlooked because it doesn't seem alarming. You might think maybe I'm just out of shape or it's part of getting older. But there's a difference between losing breath after walking upstairs and struggling to breathe while sitting still. Let's take an example. Mr. Jennings, 74, noticed that he'd started waking up at night, gasping for air. At first he blamed it on dry air or anxiety, but over a few weeks walking across the room made him feel lightheaded. A visit to his doctor revealed early signs of heart-related fluid buildup in his lungs. Thanks to early detection, he got the support he needed before things worsened. In some cases, unexplained breathlessness can even point to what doctors call a silent heart attack, when the heart is in distress without the usual crushing chest pain. It may come with nausea, cold sweats, or overwhelming fatigue, and is often mistaken for something minor. At Senior Wisdom, we encourage you to trust your instincts. You know your body better than anyone. If your breathing suddenly changes even slightly, pay attention. So what should you do if you feel short of breath without clear cause? Sit down, stay calm, and seek medical attention as soon as possible. If it happens repeatedly or during rest, don't wait. Let your healthcare provider know every detail, how often it happens, what brings it on, and how long it lasts. Here at Senior Wellness, we believe every breath matters, not just physically, but emotionally too. Breathing freely means living fully, and no one should ignore signs that the body is struggling to keep up. Getting older doesn't mean accepting discomfort as normal. You deserve to feel strong, steady, and supported, and sometimes the smallest symptoms are the body's most important messages. So please don't minimize it. Stay aware, take notes, and if needed, speak with your doctor. Your well-being is worth protecting one breath at a time. Drastic and unexplained weight loss. Losing a few pounds can sometimes feel like a good thing, especially if you've been trying to eat healthier or move more. But when weight begins to drop quickly and without any intentional changes in diet or activity, it's time to pause and pay close attention. For adults over 60, unintentional weight loss can be more than just a curiosity. It can be a warning sign. Doctors often associate this symptom with deeper health concerns, especially when it happens rapidly or without a clear cause. While many people think of aging as naturally leading to a smaller appetite or slight changes in body shape, noticeable weight loss that happens suddenly should never be ignored. One of the most serious underlying causes can be undiagnosed illness. Conditions like cancer, particularly of the pancreas, lungs, or digestive system, may cause the body to burn through energy much faster than normal. The immune system trying to fight back uses more resources and weight can fall off without warning. Let's take the story of Ms. Rivera, age 70. She didn't change her diet, but her clothes started feeling looser. Friends commented that she looked thinner, and she began feeling weaker, even though she hadn't done anything differently. With encouragement from her daughter, she went for a checkup. Her doctor ran some tests which led to an early diagnosis that allowed for timely care and recovery. Aside from serious illness, unintentional weight loss can also be tied to issues like poor nutrient absorption, thyroid disorders, chronic infections, or even undiagnosed diabetes. Sometimes inflammation in the body causes the metabolism to speed up burning calories faster than usual. These types of metabolic or immune challenges often go unnoticed until weight becomes visibly affected. At Senior Wisdom, we understand that changes in the body can be confusing, even frightening. But when you're informed, you're empowered. So what should you do if you've lost weight unexpectedly, especially more than 5% of your body weight in a short period of time? Start by writing things down. Note when the weight loss began, if your appetite has changed, or if you're feeling more tired than usual. Then reach out to your healthcare provider for guidance. Here at Senior Wellness, we believe in proactive care, and that includes paying attention to the subtle signs. Your body is always speaking to you. And when something feels off, it's okay, even wise to ask questions. This isn't about fear. It's about honoring your health, trusting your instincts, and taking steps toward peace of mind. Because when you listen early, you act early, and that can make all the difference for a long, vibrant life. Confusion, disorientation, or sudden personality changes. There's something especially unsettling about feeling like your thoughts are slipping, or watching a loved one suddenly act in ways that seem unfamiliar. Confusion, disorientation, or sudden changes in personality are more than just senior moments. They may be signs that something serious is affecting the brain, and they deserve close attention. As we age, it's normal to occasionally forget where we put the keys or mix up someone's name. But when confusion becomes frequent, when someone forgets familiar faces or places, or when their personality shifts dramatically and quickly, it may be the body's way of signaling a deeper issue. Doctors often associate these symptoms with several possible conditions, including stroke, brain infections, reactions to medications, or the early signs of Alzheimer's or other types of dementia. Sometimes it can even be something as treatable as a urinary tract infection, which in older adults can lead to sudden mental changes, especially if left unrecognized. Let's take the story of Mr. Daniel, age 76. His daughter noticed he seemed more agitated than usual, snapping at small things, forgetting where he was driving, or calling the dog by the wrong name. At first she thought it was just stress, but when it continued, she encouraged him to see a doctor. It turned out that a medication he'd recently started was affecting his cognitive clarity. With a simple adjustment, his confusion eased. These moments can be scary, not just for the person experiencing them, but for family and friends too. The important thing is to remember that you're not alone, and that early recognition can lead to real solutions. At Senior Wisdom, we believe that understanding the signs is an act of empowerment, not fear. Recognizing when something isn't right gives you and your loved ones the chance to respond with care and clarity. So what should you watch for? Be mindful of behavior that feels sudden and out of character. Is someone forgetting things they've always known? Are they having trouble following a simple conversation or seem easily confused in familiar places? Are they acting more irritable, withdrawn, or different than usual? If these signs appear, don't wait. Write down what you notice, how often it happens, and any recent changes in medication routine or health. Then talk with a doctor. It could be something temporary or something that needs immediate attention. Here at Senior Wellness, we know that brain health is just as important as physical health. Your thoughts, your memories, your sense of self, they're all worth protecting. When you stay curious, aware, and connected, you give yourself the best chance to continue living fully with strength, dignity, and clarity of mind. Severe and persistent abdominal pain. We've all had the occasional stomach ache, maybe from something we ate or just a little indigestion. But when abdominal pain is sudden, sharp, or refuses to go away, it's your body's way of signaling that something more serious may be happening inside. As we get older, it's easy to dismiss these pains as just gas or something I ate, but persistent and intense discomfort in the abdominal area could point to urgent medical concerns. Doctors warn that this type of pain, especially when it worsens over time or comes with other symptoms, can be a sign of serious internal conditions that should never be ignored. One such condition is a ruptured abdominal aortic aneurysm, a rare but extremely dangerous event where the body's largest artery weakens and tears. The pain can be deep pulsing and may radiate into your lower back. This requires immediate emergency care to prevent internal bleeding and further complications. Another possible cause is intestinal blockage, or loss of blood flow to the intestines, which can occur due to clots or a twisted bowel. These conditions often cause a hard, swollen abdomen and may be accompanied by nausea or vomiting. If left untreated, they can lead to life-threatening infections. Let's take an example. Ms. Clara, 75, began having mild discomfort after meals. She assumed it was just heartburn, but one day the pain became sharp, lasting for hours. Her daughter convinced her to seek help. Tests showed gallbladder inflammation caught just in time to avoid surgery. Other causes like pancreatitis or gallbladder issues can also create pain that spreads across the upper abdomen, especially after eating fatty foods. While some symptoms may mimic heartburn or acid reflux, the key difference is intensity, persistence, and how your body responds to rest or medication. At Senior Wellness, we believe in honoring your body's messages. Pain is never just a nuisance, especially when it interferes with daily life, limits your movement, or changes the way you eat and sleep. So what should you watch for? Take note if the pain comes on, suddenly grows more intense, or doesn't go away with rest. If it's paired with fever, vomiting, dizziness, or unusual bowel habits, it's time to call your doctor, or in some cases seek urgent care. Trust your instincts. You've lived long enough to know when something doesn't feel right. And when in doubt, speak up. A short conversation with your physician can make all the difference. Here at Senior Wisdom, we encourage you to stay informed and empowered. You deserve peace of mind, and that comes from taking action when your body is asking for care. Because in the world of senior living, your well-being isn't just about adding years to life, it's about adding life to the years you've earned. Getting older doesn't mean losing control, it means learning to listen more closely to your body's quiet wisdom. The symptoms we've talked about today aren't meant to cause fear. They're reminders that your health still matters, that your life still matters, and that you deserve the very best care and attention. By staying aware, asking questions, and seeking help when something feels off, you're not being overly cautious, you're being wise. And that wisdom is what Senior Wellness is all about. We hope this video helped you feel more informed, more empowered, and more confident in your ability to care for yourself or someone you love. If it brought you clarity or comfort, please consider subscribing to our channel. It helps us continue sharing meaningful content for the journey ahead. Tap the like button if you found this helpful, and if you'd like to share your thoughts or experiences, we'd be honored to read your comments below. Take care of your body, trust your instincts, and remember you are never alone on this path.